Let's talk about diabetes. It's a word that gets thrown around a lot, but what does it really mean? Many people think diabetes is just about eating too much sugar. That's a myth. Diabetes is a bit more complex than that. It's true that sugar plays a role, but it's not the whole story. There are different types of diabetes, each with its own set of causes and challenges. Today we're going to break down the differences between type 1 and type 2 diabetes. We'll clear up some common misconceptions along the way. Get ready to unravel the mysteries of this often misunderstood condition. Let's dive in. To understand diabetes, you need to meet the power couple of our bodies, glucose and insulin. Glucose is like the fuel that keeps our cells running. Think of it as the energy drink for our bodies. We get glucose from the food we eat, especially carbohydrates. But glucose needs a special helper to enter our cells and provide energy. That's where insulin comes in. Insulin is a hormone made by the pancreas, a gland tucked away behind our stomach. Insulin acts like a key, unlocking the doors of our cells so glucose can get in. When everything is working properly, it's a beautiful partnership. But what happens when the dynamic duo faces trouble? That's when diabetes steps onto the scene. In type 1 diabetes, the body's immune system, which normally protects us from invaders like bacteria and viruses, gets a little confused. It mistakenly attacks the insulin-producing cells in the pancreas. It's like the immune system suddenly decides that the pancreas is the enemy. As a result, the pancreas can't produce enough insulin, or in some cases, any insulin at all. This means glucose can't enter the cells as it should, leading to high blood sugar levels. Type 1 diabetes often develops in childhood or adolescence, but it can occur at any age. It's crucial to remember that type 1 diabetes is not caused by eating too much sugar or having an unhealthy lifestyle. It's an autoimmune condition, meaning the body attacks itself. Genetics can play a role, but the exact cause is still a bit of a mystery. Type 2 diabetes is the most common type of diabetes. It usually develops gradually over time, often in adulthood. In type 2 diabetes, the body either doesn't produce enough insulin or the cells become resistant to it. Think of it like this. The key, insulin, is there, but the lock of cell receptors is rusty and doesn't work properly. This is called insulin resistance. As a result, glucose can't enter the cells efficiently, leading to high blood sugar levels. Unlike type 1 diabetes, lifestyle factors play a significant role in the development of type 2 diabetes. Being overweight or obese, lack of physical activity, and an unhealthy diet can all increase the risk. The good news is that many of these risk factors can be modified with lifestyle changes. Now that we've met both types of diabetes, let's look at their key differences. Type 1 is an autoimmune disease where the body attacks its own insulin-producing cells. It often develops in childhood and requires lifelong insulin therapy. Type 2 diabetes, on the other hand, is primarily driven by lifestyle factors and usually develops in adulthood. While some people with type 2 diabetes may eventually require insulin, lifestyle changes and other medications can often manage the condition. Both types of diabetes involve high blood sugar levels and can lead to serious health complications if left untreated. Diabetes can be sneaky and often goes unnoticed. Sometimes it doesn't show any symptoms at all, especially in the early stages. This is why it's often called a silent disease. However, when symptoms do appear, they can be pretty telling and should not be ignored. Keep an eye out for these red flags: increased thirst and frequent urination. These are some of the most common symptoms. High blood sugar levels can cause your body to try and flush out the excess glucose through urine, leading to increased thirst and frequent trips to the bathroom. This can be very disruptive to your daily life. Unexplained weight loss is another significant symptom. When your body can't use glucose for energy efficiently, it may start breaking down muscle and fat for fuel, leading to weight loss. This can happen even if you are eating normally or more than usual. Increased hunger. Even if you're eating more than usual, you might still feel constantly hungry because your cells aren't getting enough glucose. This can be frustrating and confusing. Fatigue. Without enough glucose to fuel your cells, you might feel tired and sluggish. This kind of fatigue can affect your ability to perform daily tasks and reduce your overall quality of life. Blurry vision. High blood sugar can damage the tiny blood vessels in your eyes, leading to blurry vision. This can make it difficult to focus and perform tasks that require clear vision. If you experience any of these symptoms, it's crucial to see your doctor and get tested for diabetes. Early diagnosis can make a significant difference in managing the disease. Early detection and management are key to preventing complications. By catching diabetes early, you can take steps to control your blood sugar levels and maintain a healthy lifestyle. Managing diabetes is a lifelong journey, but it's not an impossible one. It requires dedication, education, and a proactive approach to health. With the right knowledge, support, and a sprinkle of determination, you can live a full and healthy life with diabetes. Surround yourself with a supportive community, whether it's family, friends, or healthcare professionals. The cornerstone of diabetes management is keeping your blood sugar levels within a healthy range. This means understanding how different foods, activities, and medications affect your blood sugar. This typically involves a combination of lifestyle changes, medications, and regular monitoring. Each of these components plays a crucial role in maintaining your health. Lifestyle changes. Eating a healthy diet, exercising regularly, and maintaining a healthy weight are crucial for managing both type 1 and type 2 diabetes. Incorporate a variety of fruits, vegetables, lean proteins, and whole grains into your meals. And maintaining a healthy weight are crucial for managing both type 1 and type 2 diabetes. Regular physical activity helps your body use insulin more efficiently and can improve your overall well-being. Medications. People with type 1 diabetes require insulin therapy to replace the insulin their bodies don't produce. It's essential to follow your prescribed insulin regimen and understand how to adjust doses based on your daily activities and meals. People with type 2 diabetes may need other medications to help their bodies use insulin more effectively or to increase insulin production. These medications can be oral or injectable, and your healthcare provider will help determine the best options for you. Monitoring. Regularly checking your blood sugar levels helps you understand how your body responds to food, exercise, and medications. Keeping a log of your readings can provide valuable insights and help you and your healthcare team make informed decisions. Remember, managing diabetes is a team effort. Don't hesitate to reach out for support when you need it. Whether it's emotional support from loved ones or professional guidance from healthcare providers, you're not alone in this journey. Work closely with your healthcare team, including your doctor, diabetes educator, and registered dietitian, to develop a personalized plan that works for you. Regular checkups and open communication with your healthcare providers are key to staying on track and making necessary adjustments to your management plan. Diabetes is often surrounded by myths and misconceptions. These myths can lead to confusion and misinformation, making it harder for people to manage their condition effectively. Let's bust some of the most common ones and set the record straight. Myth: eating too much sugar causes diabetes. This is a widespread belief, but it's not entirely accurate. Fact: while a diet high in sugar can contribute to weight gain, which is a risk factor for type 2 diabetes, it doesn't directly cause diabetes. The development of diabetes is influenced by a combination of genetic and lifestyle factors. Myth: people with diabetes can't eat sweets. This myth can make life unnecessarily restrictive for those with diabetes. Fact: people with diabetes can enjoy sweets in moderation as part of a balanced diet. The key is to plan ahead and make thoughtful choices. The key is to monitor your carbohydrate intake and balance it with other nutrients. Working with a dietitian can help you create a meal plan that includes your favorite treats. Myth: only overweight people get diabetes. This misconception can lead to stigma and misunderstanding. Fact: while being overweight or obese is a significant risk factor for type 2 diabetes, people of all shapes and sizes can develop diabetes. It's important to understand that diabetes is a complex condition with multiple risk factors. Myth: diabetes is contagious. Fact: diabetes is not contagious. You can't catch it from someone else through casual contact or social interactions. You can't catch it from someone else. It's a non-communicable disease that results from a combination of genetic, environmental, and lifestyle factors. It's essential to separate fact from fiction and get your information from reliable sources such as your healthcare provider or reputable diabetes organizations. Staying informed can help you manage diabetes more effectively and improve your quality of life. Receiving a diabetes diagnosis can be overwhelming, but it's not a life sentence. Millions of people are living full and active lives with diabetes. Remember, you are not alone. Managing diabetes is about making healthy choices and taking charge of your health. It's about finding what works best for you and your body. It's about embracing support from loved ones and healthcare professionals. With the right tools, knowledge, and a positive mindset, you can thrive with diabetes. Don't let diabetes define you. Define how you live with diabetes.